Hello, Dr. Fryer here, Dynamic Disc Designs. I wanted to share a couple concepts regarding the refractory period. And I think there is an opportunity that we can use it to enhance our treatment techniques and outcomes. So when it comes to the cervical spine, keep in mind that we have a few studies now where actually, let's take for example, left rotation and right lateral flexion will gap open the contralateral side, right? Now during the refractory period, which will give you increased laxity of the joint, very similar to a knuckle joint, so you can see that there's pretty good adherence, but as soon as it gaps open, now you've got this increased mobility during the refractory period, which ranges from individual to individual, but we've got time after the event. Now, Dr. Shacklock talks about static openers. So remember that if you left rotate, right lateral flex, the left articular pillars are going to gap open, right? I don't know how specific we can be, but we can take advantage of that. And with that, you've got to come back on the other side, right? Because now right rotation opens up the IVFs, right? So you can have straight rotation, and because of the orientation of the facet joints, that will slide and gap open, right? You can use right lateral flexion as well to gap that open, right? And possibly even distraction, straight linear distraction, because now the facet has lost its adherence, or its the ability to kind of hold things in a stable way. We could take advantage of that, and maybe we can open up the IVFs a little bit more to facilitate venous return. So anyways, I hope that's helpful.